So, Assalamualaikum warahmatullahi wabarakatuh. We are from Group 4 and today we will present about our case presentation. So, this is the outline of our presentation. So, for trigger 1, we will talk about the condition of Razak ankle, and for trigger 2, we mainly talk about the osteomyelitis, the trigger 3 about the osteosarcoma, the trigger 4 our confirmed diagnosis, which is osteosarcoma. Next. So this is the timeline of event that Razak has gone through. Okay, so at childhood, he has serious eczema. Then he took a series of radiotherapy sessions for his eczema disease. Then until he is 9 years old, finally his treatment for eczema was successful. At that time, his parents worked as farmer, which is cauliflower and cabbage farmers at Cameron Highland. And then and when he is 15 years old, he fell and got a cut on his ankle during football training. This time he just applied ointment on his injuries, and 11 days later he got a fever and his ankle became swollen. He ignored the symptom and still go to his football tournament. And unfortunately, 3 days later, he fell for the second time during the tournament, and he is in intense pain and unable to move the leg. So this is how we reach the current condition of Razak, in which we try to discover what is his real disease. So I will pass to the next presenter.
Okay, so basically in trigger 1, next slide. Razak was in intense pain and unable to move his leg. As there is no other information provided, we only came up with the possible causes, which are either inflammation, dislocation of his ankle, and also sprained ankle. So inflammation as the immediate response of tissue due to injury, dislocation when the joint become knocked out of usual position, and also sprained ankle and injury to one or more ligaments in the ankle. So I pass to the next presenter to further explain this case.
Okay, next let's go through with the second trigger. Okay, for the second trigger, Razak has go through the X-ray, and it can be reject that either they are not show the joint dislocation and sprained ankle, and it only show the lactic lesion. So from that, we come out with the osteomyelitis. For the reason the histological result, which is show the osseous and soft tissue changes and the lactic lesion. It's also being treated with intravenous antibiotic treatment. Okay, let's go through with the third trigger.
Okay, so moving to the third trigger. Next slide. Okay, so there are three main facts observed from the trigger. So the first one is the ineffective treatment. So from trigger 2, Razak was assumed to suffer from osteomyelitis. So he was given an intravenous antibiotic treatment. However, in trigger 3 stated that his condition was not improving, although he has completed the course treatment. And the pain on his joint was excruciating and the swelling on his ankle has not subsided. Thus, and we further discuss as to why the treatment is not effective. So we figure out that Razak condition is actually was not caused by bacterial infection, and so we assume that Razak does not have osteomyelitis, but he suffered from a type of bone cancer, which is osteosarcoma. And this brings out to the question, so how Razak develops the osteosarcoma? So the answer is from a second fact stated that he has a medical history of serious eczema since childhood, and thus he receives a series of radiation therapy to treat the disease. And the third fact is that his parents are farmers, meaning that Razak and his parents were exposed to the pesticide used in the farming process in a long time. So Razak actually has three risk factors that leads him to develop osteosarcoma, which are the exposure to the radiation, the exposure to the pesticide, and also the possibility of having gene mutation that is caused by the exposure of radiations and pesticide. So let us go through the risk factor one by one. So Razak has been exposed with radiation since a younger age, has as he had a series of radiation therapy for his eczema. So the radiations affect the cells to direct and indirect action, causing the DNA damage and mutation. Also, the high exposure to radiation could prevent the DNA from replicating correctly, and this increases the risk of cancer. Next, Raza also exposed to the pesticide, and the harmful substance in the pesticide can cause oxidative DNA damage, DNA adducts, which is a segment of DNA bound to a cancer-causing chemical, and a single or double-strand DNA breaks. And this also increases the risk of cancer. And for the third risk factor, the possibility of gene mutation. And as I said earlier, Razak may have a gene mutation caused by the exposure to the radiation and pesticide. And also Razak may have inherited the mutated gene from his parent, as his parent is exposed to the pesticide for much longer, that result in a DNA damage, and it is inherited to Razak. So hence from this factor, we concluded that Razak has an osteosarcoma. So to discuss about osteosarcoma, I pass to the next presenter.
Okay, thank you, Sister Nadia. Okay, so we conclude that Razak had osteosarcoma. So from trigger 4, okay, we get the evidence that Razak actually had osteosarcoma. So first, from trigger 4, we get the facts that the test looking for chromosome or gene changes in the biopsy samples were performed, and then the results show a single nucleotide polymorphism of glutamate receptor metabotrophic 4 that we call GRM4, and blood tests revealed high levels of alkaline phosphatase ALP and lactase dehydrogenase LDH. And from trigger 4 also we see the histology picture that we analysis that there are abnormal mitosis and also produce malignant osteoid. So for the discussion, okay, from trigger 4, we get the evidence from genetic tests, blood tests, and histopathology. For genetic tests, okay, the result show that single nucleotide polymorphism SNP of glutamate receptor metabotrophic for GRM4. So basically, GRM4 is a tumor that involved in signaling pathway that stimulates the formation of osteosarcoma by inhibit the CAMP pathway. And from blood tests, alkaline phosphatase ALP and lactate dehydrogenase LDH show the high level. Okay, that one of the causes that the level of ALP and LDH is higher is because of osteosarcoma and also cancer. And next, from the histopathology, okay, we analysis that there are malignant osteoid and also had abnormal mitosis that we can say that there are gene mutated there, and also it is the result in the formation of the malignant primary bone tumor that known as osteosarcoma. So for the details of the osteosarcoma, I pass to the next presenter.
So for the trigger, we conclude that Razak has developed osteosarcoma. Next. So osteosarcoma is a cancer of the bone that result from cancerous cells or abnormalities of the cells. So we can see that from the biopsy samples, there are some abnormalities of chromosome occurs. So we can conclude that this is the sign of osteosarcoma. So there are signs or symptoms that people who develop osteosarcoma, such as bone pain, swelling, redness, and also retulations. So the risk factors that might occur is exposure to radiation, where we know that Razak has eczema. Well, it is radiation therapy, so maybe it developed from there. And exposure to a pesticide that his parents is a farmer, so that maybe he got from there. And lastly, gene or chromosome mutation. So there are many types of osteosarcoma. There are medullary osteosarcoma and also peripheral osteosarcoma. So for medullary osteosarcoma is known as central tumor. First, in this osteosarcoma is conventional central osteosarcoma, such as osteoblastic, chondroblastic, and also fibroblastic. So for telangiectatic osteosarcoma, it is demonstrate very little osteoid production. So it composed of cystic cavities containing necrosis and also hemorrhage. So for intraosseous well differentiated osteosarcoma, this is actually a rare case where intramedullary bone will produce tumor, and this disease is actually difficult to diagnose. So for second type of osteosarcoma, which is peripheral osteosarcoma, is known as bone surface tumor. There are two: parosteal osteosarcoma and also perisosteal osteosarcoma. So for parosteal osteosarcoma, it is actually a low-grade fibroblastic tumor and that will produce osteoid. And this is the most common type of peripheral osteosarcoma. So next is periosteal osteosarcoma, which is a rare type of bone cancer, and it usually forms on the surface of bone of lungs that call bone of legs that call tibia and femur.
Okay, so for the pathogenesis of osteosarcoma begins when a healthy bone cell develops changes in its DNA. Once there is a mutation, eventually it will cause the formation of malignant osteoid tissue. The excessive growth of the tumor in the bone will causing three effects, which are separation of red bone marrow, pressure inside the bone, and also cancer cell metastasis. These effects will also lead to other adverse effects. Next slide. So for the diagnosis, to confirm an osteosarcoma diagnosis, a physician will usually begin by discussing the patient's symptom, taking a complete medical history, performing a physical examination, and also imaging. These can be seen from the third trigger. Then they will proceed with either perform blood tests or genetic tests as in the trigger 4. As for the treatment, osteosarcoma is often treated with a combination of therapies that can include surgery to remove all the cancer cells, chemotherapy, and also radiation therapy that is performed when a tumor is difficult to remove surgically or when residual tumor cells remain after surgery. Next slide. And lastly, for the most important part, which is the conclusion, we figured that Raza is suffered from osteosarcoma. So here I will explain all of our reasoning. The first one is because of the appearance of lytic lesion based on radiographic image from trigger 2. The reason why we excluded other possible bone tumors and chose osteosarcoma is because of the second basis, which is Razak's age. The risk of osteosarcoma is highest for those between the ages of 10 and 30. Raza is 15 years old boy, which is the age of growth spurt. So there is high possibility of osteosarcoma. Moreover, for the third reason, it is believed that Raza is experiencing osteosarcoma due to DNA mutation from environmental factors from his childhood, such as radiation therapy and also exposure to pesticides. So further treatment may be needed for him to prevent the cancer cell from spreading to other parts of the body. So I think that's all from my group and I hope all of you can understand our case presentation. Thank you and Assalamualaikum.